I want to ask you a question you've probably never asked yourself. What if the medical tests you get every year don't always protect you? What if some of them, the ones presented as routine, the ones your doctor says are essential after 70, can actually do you more harm than good? I know that sounds impossible. I know it goes against everything you've been taught about taking care of your health. But listen carefully to this. Recent studies reveal that up to 37% of medical tests performed on older adults lead to unnecessary treatments, serious complications, or permanent side effects. And the most disturbing statistic of all, one of the tests on this list, number 1, is directly linked to the appearance of cancers in completely healthy people who simply went in for a routine checkup. That information exists in the science. It's published in the most respected medical journals in the world. But you'll never see it on a poster in your doctor's waiting room. You'll never have it explained in a 15-minute appointment. Because the medical system is not designed to tell you when to do less. It's designed to do more. Gerald was 74 years old. Active, no symptoms, no pain. He walked every day and felt good about himself. He went to his annual checkup convinced he was caring for his health in the best possible way. He left with 4 additional tests scheduled. 2 weeks later, he was in the hospital recovering from a serious complication caused by one of those tests, a test that no one had explained to him he could and should question. His wife called me in tears. Dr. Penfield, he walked in on his own 2 feet and now he's in bed. How is it possible that a health checkup did this to him? His story is not exceptional. It is the story of thousands of older adults every year. I'm Dr. Arthur Penfield. And today I'm going to reveal the 5 medical tests you should question, or directly avoid, after age 70. Not because medicine is the enemy, but because you have the right to know exactly what happens to your body when you undergo these tests. And you have the right to make informed decisions about your own health. Stay until the end because the number 1 test is going to impact you deeply, and it's likely you've already had it, or someone close to you is about to. I've spent more than 35 years alongside older adults, and there's a truth I've learned over time that no medical textbook teaches clearly enough. Modern medicine is extraordinarily powerful for treating serious diseases, but it has a serious problem when applied routinely to healthy older adults. The tendency to do more than necessary. More tests, more scans, more interventions. With the best intentions in the world, doctors genuinely want to help, but without always considering whether the real benefit justifies the real risk for a person of 72 or 80. I've seen patients who entered the medical system for a routine checkup and came out with diagnoses that paralyzed them with fear for months. Diagnoses that upon calm investigation turned out to be completely normal variations of aging, not diseases. But the emotional damage was already done, and in some cases the physical damage too. Today I'm not telling you to stop seeing your doctor, quite the opposite. I'm giving you the tools to go better informed, so that when your doctor proposes one of these tests, you can ask the right questions. So you can say with confidence, "Doctor, what is the real benefit of this test for someone my age and my current condition? And what are the specific risks?" That informed conversation can save you from years of unnecessary treatments and complications that nobody was looking for, but that happen. Before we begin, tell me in the comments, where are you watching from and how old are you? And if you've ever experienced a complication after a medical test, or regretted having a test that turned out to be unnecessary, write it below. Your experience might help someone who is making that decision right now. Let me explain something that doctors know but rarely communicate with sufficient clarity. There's a concept in medicine called overdiagnosis. It happens when a test detects something, an abnormality, a nodule, a slightly altered number, that would never have caused symptoms or problems in that person's lifetime. But once detected, the medical system has its own logic that is very hard to stop. It must be investigated further, treated, intervened upon. And every additional investigation, every treatment, every intervention carries its own risks. After age 70, the human body naturally has markers that in a younger person would be warning signs, but in an older adult are simply the reflection of the passage of time. A slight loss of bone density, small spots on a brain MRI, a mild arterial narrowing, millimeter-sized lung nodules, benign cysts in the kidneys. These variations are part of normal aging. They are not diseases. They don't need treatment. But when they appear on a doctor's screen, especially one who doesn't know you well and who acts with caution, they set off a cascade of additional tests, medications with side effects, and invasive procedures that can cause more harm than the condition they supposedly treated. The result is paradoxical and profoundly unjust. Healthy older adults who go in for a routine checkup and come out sick, not from disease, but from the consequences of the detection system itself. Today you'll learn the 5 tests where this problem is most frequent and most serious. And for each one, I'll tell you what safer alternatives exist. Before we get into the first test, hit that like button and subscribe with the notification bell on. This information could literally protect you from interventions you don't need. Dangerous test number 5, the bone density scan, DEXA. At first glance, it seems completely harmless. A quick test, no pain, no needles, no special preparation. You lie on a table, a machine scans your spine and hips for a few minutes, and in a short time you have a number on a piece of paper that supposedly tells you if your bones are at fracture risk. The problem isn't the test itself. It's what inevitably happens after the result. The bone density scan, technically known as DEXA, measures the mineral density of your bones and compares it to reference values. And here is the trap that no one explains when it's prescribed. After age 70, virtually all adults, and especially women, have results below those reference values. Not because they're sick, but because those reference values were established by comparing bone density of young adults. It's like measuring a 75-year-old's running speed and comparing it to a 25-year-old athlete to conclude they have a problem. Loss of bone density is an absolutely normal part of aging. It happens just like wrinkles, gray hair, or the loss of skin elasticity. It happens to everyone. But when that result appears on paper with numbers and percentages, the medical system tends to interpret it as a pathology requiring treatment. And the standard treatment is bisphosphonates, medications like alendronate, Fosamax, or risedronate, Actonel, that supposedly strengthen bones, but whose side effects in older adults include severe esophageal irritation, chronic digestive disorders, difficulty swallowing, and in documented cases, though less frequent, something called osteonecrosis of the jaw, a complication in which the jawbone literally begins to die from lack of blood supply. The most impactful finding is about real efficacy. A study published in the Journal of the American Geriatric Society followed more than 100 women over 70 treated with bisphosphonates for 5 years. The medications reduced fracture risk by 0.3%. Not zero, but a benefit so small as to be nearly imperceptible compared to the adverse effects all those women were exposed to throughout that time. Dorothy was 76 years old, a retired piano teacher, active, walked every day, had never fallen, had no joint pain, no sign of fragility whatsoever. At her annual checkup, her doctor routinely prescribed a DEXA scan. The results showed osteopenia, a mild decrease in bone density that technically isn't osteoporosis, but that frightened both her doctor and herself. Without further analysis or discussion, her doctor immediately started treatment with alendronate. 3 months later, Dorothy was suffering from severe esophageal reflux that made eating difficult. She had jaw pain, and what distressed her most, she hadn't been able to play piano in weeks. Her hands trembled and her jaw hurt when she concentrated. When she came to my practice, we suspended the treatment and designed a completely different protocol based on lifestyle. Vitamin D3 with K2, progressive resistance exercises with resistance bands, walks with body weight, and a diet rich in bioavailable calcium. Sardines with bones, dark leafy greens, fermented dairy. 1 year later, Dorothy was playing in public again. She had more strength in her legs, better walking balance, and 0 fractures. She told me something I haven't forgotten. Dr. Penfield, the test that was supposed to protect me almost took away the thing I love most in life. What you should know. If you're over 70, have never fallen, and have no prior unexplained fractures, a DEXA scan rarely provides real clinical value that justifies the risks of the subsequent treatment. A 2022 study in Osteoporosis International demonstrated that resistance exercise, balance training, and correction of vitamin D deficiency reduce fracture risk by more than 20% without adverse effects. Before getting a DEXA, always ask, what are we going to do with the result? If it comes back low, what is the real benefit of treatment for my age and specific situation? That question can save you years of unnecessary medications. Dangerous test number 4, brain MRI for mild forgetfulness. When an older adult starts forgetting where they left their keys more often, occasionally mixing up a name, or feeling their mind isn't responding with the same agility as before, the fear that immediately appears is intense. The fear of dementia, the fear of Alzheimer's, the fear of losing the mind. That fear, completely understandable and human, leads many doctors to immediately prescribe a brain MRI, with the best intention, to rule out something serious before it progresses. The problem isn't the intention. The problem is what happens when the results come back. In people over 70, the vast majority of brain MRIs show something that looks concerning in the report. A slight brain shrinkage, small white matter spots, areas of slightly altered signal, images that to any person without medical training, and to many with it, appear to be serious warning signals. But these images are part of completely normal brain aging. They are as predictable as skin wrinkles. They don't indicate dementia. They don't predict Alzheimer's. They don't require any treatment whatsoever. They are simply the imprint of time's passage on the brain. The problem is that once those images are on paper, it is psychologically very difficult to ignore them. A study published in Neurology Today in 2021 analyzed more than 3,000 MRIs performed on patients aged 70 to 85 who presented with mild cognitive concerns, occasional forgetfulness, mental slowness, difficulty finding words. The result was revealing and disturbing. 86% of those patients showed some visible brain abnormality, but only 3% of those abnormalities corresponded to a truly treatable or manageable condition. The remaining 97% were simply normal variations of brain aging, and yet nearly 12% of those patients were referred to invasive procedures, lumbar punctures, exploratory biopsies of the nervous system, based solely on images that simply reflected the age of the brain, not a disease. George was 74 years old, a retired engineer completely lucid in conversation, active with a full social life. He noticed he was losing his keys a bit more frequently than before, and sometimes took a moment to recall a name. His doctor, with good intentions, sent him for an MRI to rule out something serious. The report read, "White matter lesions consistent with small vessel encephalopathy." George read that report without a doctor to calmly explain it, and he entered a panic that changed his life for months. He stopped driving, convinced he was a danger. He stopped going to church, seeing friends, going out alone. The anxiety he developed worsened his sleep, his appetite, and paradoxically his memory, because chronic fear is one of the factors that most deteriorates cognitive function in older adults. When he came to my practice, we performed a complete standardized cognitive evaluation with validated tests. His score was perfectly within the normal range for his age. I explained in detail that those images simply corresponded to his 74-year-old biology, not to any treatable disease. We refocused on what truly mattered: improving sleep quality, increasing hydration, incorporating daily mental stimulation, resuming the physical activity he'd abandoned. 3 months later, George was driving again, had resumed all his activities, and told me with relief, "Dr. Penfield, I lost months of my life trapped in a fear that had absolutely no real basis. Why didn't anyone explain this to me sooner?" What you should know. Without serious and objective neurological symptoms, epileptic seizures, an abrupt and inexplicable personality change, rapid functional deterioration over weeks, a brain MRI rarely provides clinically useful information for mild forgetfulness in older adults. The most appropriate and much safer first step is always a standardized cognitive screening test, a simple paper or screen test that evaluates memory, attention, spatial reasoning, and language. It's inexpensive, quick, non-invasive, and above all, it doesn't generate the paralyzing panic that a poorly contextualized brain image can cause. If this video is opening your eyes to information you never heard in any doctor's office, share it right now with someone over 70 you know, by text, by email. This information can protect them from consequences nobody warned them about. I'm asking you from the heart. Hit that like button and we continue. Dangerous test number 3, the cardiac stress test. This is one of the most frequently prescribed tests to older adults, and one that generates the most unnecessary and serious consequences when applied without the correct indication. When an older adult mentions in an appointment that they get tired a bit more climbing stairs, feel some chest pressure occasionally, or simply aren't as fit as they were 10 years ago, the first reflex of many doctors is to schedule a cardiac stress test. The test monitors the heart while you walk on a treadmill at increasing speed, or while you receive a medication that simulates the effect of exercise if you can't walk. Its goal is to detect blocked coronary arteries that might cause a heart attack. The serious and documented problem is the accuracy of this test in adults over 70. Studies show that in this age group, the rate of false positives, cases where the test signals a problem that doesn't actually exist, can reach 40%. 4 out of every 10 abnormal results in older adults don't correspond to any real heart disease. They are normal variations of a heart that has been beating for 70 years and looks exactly as expected. But once the result is abnormal, the medical system follows its internal logic. A coronary angiography is scheduled. A mild arterial narrowing is identified, which in a person over 70 may be absolutely expected and not dangerous, and frequently a stent is placed to open it. A landmark study published in JAMA Cardiology in 2017 analyzed thousands of stents placed following stress tests and revealed that more than half were implanted in patients with no real symptoms and no demonstrable clinical benefit. Those patients saw no improvement in survival or quality of life after the intervention. But they were exposed to internal bleeding, kidney problems caused by the contrast agent used, and prolonged hospital stays that generated their own complications. Raymond, 75 years old, a retired mail carrier who walked 4 to 5 miles daily to stay active. At a routine checkup, he mentioned almost in passing that he sometimes felt a bit tired climbing steep hills. His doctor, wanting to be cautious, scheduled a stress test, just to be sure. The results were inconclusive. Not clearly normal, not clearly abnormal. That gray zone is especially frequent in older adults. Raymond was referred for a cardiac catheterization, an invasive procedure that threads a thin tube through the femoral artery all the way to the heart. A mild narrowing in a secondary artery was found. A stent was preventively placed. That same night, Raymond had a reaction to the contrast medium used and developed acute kidney injury. He spent 6 days hospitalized and needed several weeks of additional care and nephrology follow-up. His energy climbing hills, by the way, didn't improve at all after the intervention. Because his fatigue wasn't a heart problem, it was simply the normal tiredness of a 75-year-old man who needed better daily hydration, more rest between meals, and perhaps an adjustment to his walking routine. What you should know: if you're over 70 and don't present classic, well-defined cardiac symptoms, chest pain or pressure that clearly appears with exertion and disappears at rest, significant shortness of breath during activity you didn't have before, frequent irregular palpitations, a stress test has a high probability of causing more problems than solutions. Safer alternatives to discuss with your doctor: a resting EKG that analyzes the heart's electrical rhythm and structure without the risk of a false positive, or a coronary calcium score, a very low radiation image that objectively shows whether there is plaque accumulation in the arteries, without the cascade of interventions that a misinterpreted stress test can trigger. Dangerous test number 2, colonoscopy after age 75. This is the test that is hardest for me to include on this list, and I include it with all the respect that a procedure deserves that has saved many lives over the decades. Colonoscopy is one of the pillars of colorectal cancer prevention medicine in people aged 50 to 70, where the benefit-risk relationship is clearly favorable. The problem occurs when it is systematically performed beyond age 75 in people without specific symptoms, when that relationship changes dramatically. The preparation for a colonoscopy is physically aggressive. The powerful laxatives that completely empty the colon can cause severe dehydration, electrolyte imbalances, dizziness, and low blood pressure. Risks that, in an older adult over 75, with more limited kidney and cardiovascular capacity, are significantly more serious than in someone of 55. The anesthetic sedation used during the procedure exposes the brain and heart to additional risks that multiply with age. And the test itself can cause direct complications, bleeds requiring transfusion, intestinal tears or perforations, and in documented cases, cardiac rhythm disorders during sedation. A study published in JAMA Internal Medicine in 2019 followed more than 1.3 million Medicare patients aged 70 or older who underwent colonoscopy. The result was statistically very clear. For every 1,000 colonoscopies performed after age 75, approximately 2 lives were saved through early detection. But more than 20 people suffered serious complications requiring hospitalization or additional treatment. A 10-to-1 risk-benefit ratio against the test when applied routinely without symptoms. And there's one more detail few people mention. Even when colonoscopy discovers polyps, many of them in people over 75 are small, extremely slow-growing, and with minimal probability of becoming malignant in that person's remaining lifetime. Removing them can cause more harm than leaving them under clinical observation. Nancy was 73 years old, an active grandmother who managed a small family business with her daughter. No abdominal pain, no blood in her stools, no changes in bowel habits, no family history of colorectal cancer. Her new doctor, recently joined to the practice, recommended she have a screening colonoscopy. She, like most of us when a doctor recommends something, fully trusted and accepted without questioning. During the procedure, a small polyp was located and removed. Nancy went home believing everything had gone perfectly. That night, she began abdominal pain that grew until it became unbearable. In the emergency room, the worst was confirmed: an intestinal perforation caused during polyp removal. She spent 9 days hospitalized, lost 11 pounds during recovery, and needed months to regain her usual energy level. When I reviewed her medical history in detail, I found she had already had 2 previous colonoscopies in the preceding 10 years, both completely normal. There was no objective clinical indication to repeat it. The removed polyp was of the hyperplastic type, practically zero risk of malignancy at any point in time. What you should know. The U.S. Preventive Services Task Force, the official U.S. body for preventive medicine, explicitly recommends stopping routine colon cancer screening at age 75 for most people. A much safer alternative, equally effective for most concerning cases, is the FIT test, a stool test done at home, no special preparation, no sedation, no complication risk, that detects the presence of occult blood in stool with sufficient sensitivity to identify most cases that need additional investigation. If the result is negative, nothing more is needed. If positive, then it makes sense to consider a directed colonoscopy with a concrete clinical indication. Dangerous test number 1, full-body CT scans. And we arrive at number 1, the most dangerous on this list, the most economically profitable for the clinics that offer it, and the one that concerns me most as a physician every time a patient tells me proudly they just had one at a private clinic. Full-body CT scans, whole-body computerized tomography offered as part of executive health packages or premium checkups, are presented with an irresistible argument: the possibility of detecting cancer in its earliest stages, when it's most treatable, before it causes any symptoms. It's an argument that appeals directly to the deepest fear of older adults, the fear of silent cancer. And that's why it's so effective. And that's why it's so dangerous. The scientific reality behind these scans is completely different from what the marketing promises, in some cases directly opposite. Each full-body CT scan emits between 10 and 20 millisieverts of ionizing radiation in a single session. To give you a concrete and understandable reference, that is approximately equivalent to 500 chest X-rays in one sitting. Ionizing radiation is a known carcinogen. It damages the DNA of cells and can induce mutations that decades later become tumors. According to a modeling study published in JAMA Medicine in 2023, the exponential increase in CT scan use in the United States may currently be responsible for up to 5% of all cancers diagnosed in this country, a figure exactly equivalent to the percentage of cancers attributable to daily alcohol consumption. Stop and process this for a moment. The test that is supposed to protect you from cancer could be causing 1 in every 20 cancers that are diagnosed. Prevention becomes the very threat. But there's a second, equally serious problem. What happens when the scan finds something, and it always finds something. In older adults, full-body CT scans inevitably reveal small lung nodules, organ calcifications, simple kidney cysts, slight lymph node size variations, tiny liver lesions. The vast majority of these findings are absolutely benign. They are simply the marks of time on the organism, like internal scars from past infections, old calcifications, or anatomical variants with no pathological significance. But once they appear in a radiology report, an alarm is triggered that is very hard to shut off, both for the doctor and the patient. The system acts: more follow-up imaging, specialist referrals, and in many cases biopsies to determine the exact nature of the finding. And biopsies carry their own considerable risks, especially in older adults. Richard was 80 years old, a former physical education teacher who still exercised regularly, in excellent cardiovascular condition for his age, and completely symptom-free. Proud of taking care of himself, he decided to get a complete executive checkup at a prestigious private clinic. The package included a full-body CT scan as part of the preventive evaluation. The scan result revealed a 3-millimeter lung nodule in the lower right lobe. What followed was an unstoppable cascade of interventions. Urgent referral to pulmonary oncology, a PET scan of the entire body, another significant radiation dose, and finally a needle biopsy guided by imaging to determine the nature of the nodule. The biopsy result was benign. The nodule was a residual calcification, probably the product of a minor lung infection suffered decades earlier, with no current or future clinical relevance. But during the biopsy, a known and documented complication of this procedure occurred. The lung partially collapsed. Richard was hospitalized as an emergency and spent 2 months in recovery, with daily breathing exercises to recover lung capacity. A man who entered the hospital in excellent physical condition left with permanently reduced lung function. All because of something that could and should simply have been left untouched. The American College of Radiology is completely categorical on this point. Full-body CT scans are not recommended as a detection method in asymptomatic individuals. There is no scientific evidence that they save lives when applied indiscriminately to people without specific symptoms. And the risks, both from accumulated radiation and from the chain consequences of inevitable incidental findings, are real, documented, and potentially serious. What you should know. If you feel well and have no specific symptoms your doctor needs to investigate, unexplained weight loss over a few weeks, blood in sputum or stool, a visible or palpable lump, persistent pain without clear cause. A full-body CT scan is not going to protect you from cancer. It's going to expose you to radiation and a chain of interventions for findings that in the vast majority of cases are benign and need no intervention whatsoever. Real prevention doesn't begin with a scan equivalent to 500 X-rays. It begins with your lifestyle, your nutrition, your physical activity, your quality sleep, and your regular checkups with your primary care doctor, who knows you and can identify the tests that truly make sense for your individual situation. Share this video right now with someone over 70 you love. Someone who's about to have one of these tests done. Someone whose doctor just recommended a full-body scan. That informed conversation, before the test, can prevent enormous harm. Please share it now. We've journeyed together through the 5 medical tests you should question or directly avoid after age 70. DEXA bone scan can lead you toward medications with serious side effects for a statistical benefit of barely 0.3%. Before getting one, ask what will be done with the result. Brain MRI for mild forgetfulness. 97% of abnormalities found are normal aging variations. It can generate paralyzing fear worse than the actual condition. A standardized cognitive test on paper is the correct first step. Cardiac stress test. With a 40% false positive rate in people over 70, it can trigger stents and unnecessary interventions with real risks. Without clear, specific symptoms, safer alternatives exist. Colonoscopy after 75, 10-to-1 risk-benefit ratio against the test when applied without symptoms. The at-home FIT test is the safe, recommended alternative for most people. Full-body CT scan, equivalent to 500 X-rays at once. It may cause the cancers it's supposed to prevent. It always triggers chain interventions from benign findings. Without specific symptoms, there is no evidence of benefit. Now I want you to understand something fundamental before this video ends. Nothing I've told you today means you should stop seeing your doctor. It means exactly the opposite, that you go better informed, that you ask the right questions, that you don't automatically accept any test without understanding its real purpose, its expected benefit, and its specific risks for your age and condition. You have the right to know. You have the right to decide. The most powerful medicine isn't always the one that does more. Sometimes, especially in older adults, the most intelligent and most courageous medicine is the one that knows when to do less, when to wait, when to observe, when the treatment is worse than the condition. That wisdom, unfortunately, rarely comes in a 15-minute appointment with a doctor seeing you for the first time. That's why this channel exists. With all my care and commitment as your doctor, Dr. Arthur Penfield. If this video gave you information you never heard in any doctor's office, I'm asking 3 simple things. Hit that like button right now. It's the most direct signal I can receive that this information is reaching the people who need it. Subscribe to the channel and turn on the notification bell. Every week I publish practical, honest medical information backed by science that you'll rarely find in a 15-minute appointment. And share this video right now with someone you love, with your parents, your spouse, that family member who is about to have one of these tests. An informed conversation at the right time can prevent enormous harm. I'm asking from the heart. Write in the comments, have you ever experienced a complication from a medical test that turned out to be unnecessary? Or have you ever regretted having a test? I read every comment and respond personally. Your experience might help someone making that decision right now. And in my next video, I'm going to reveal something that very few doctors will tell you about plants and the brain. I'm going to show you the 6 plants that a neurologist recommends to protect memory after 60. Plants with real clinical support, with studies published in serious scientific journals, that you can incorporate into your routine starting tomorrow. One of them has been shown in clinical trials to slow mild cognitive decline in a way comparable to or superior to some commonly prescribed medications. And most of them are available at any health food store or farmer's market. Don't miss it. See you very soon. Dr. Arthur Penfield.